What if I tell you you can remember muscles, their nerve supply and actions by studying just 2 pages? In this video, I will be telling you all how to study one of the most important topics in anatomy and to study it in a way so that you can remember. Anatomy is a very volatile subject. If you study one topic today and don't revise it for a week, you are most likely going to forget it. And that is the reason why revision becomes extremely important. So the first and the most important thing is revision. Now, every time you sit down to study, you cannot go through the entire chapter. You cannot go through all the pages given in the textbook for that particular topic. So the first and the most important thing is revision. You need frequent revisions of that particular topic. Next, whenever you sit down to revise, you cannot go through the entire chapter. You cannot go through all the pages given in the textbook for that particular topic. You need some concise version of that topic. And that is the reason why notes become extremely important. Now, for this topic, that is muscles, their nerve supply and action, in the textbook, in the anatomy textbook BD Chaurasia or Vishram Singh, whichever textbook you refer, a lot of pages are given for each of the muscle group. For arm, forearm, wrist, anterior compartment, posterior compartment, there are a lot of pages. Now, to combine all of that in one page is how your revision time will reduce. So I will show you how I had done. I had made a chart for lower limb. This is how you can do for lower limb and upper limb as well. So in this, I have started with sciatic nerve. Sciatic nerve divides into common peroneal, tibial. Common peroneal divides into superficial peroneal, deep peroneal, and then tibial divides into medial plantar, lateral plantar, and then so this is the nerve supply. And then at the side I have written down the muscles supplied by that particular nerve. So which are the muscles supplied by the tibial part of sciatic nerve, which are the muscles supplied by the common peroneal part of the sciatic nerve, and then at the side I have written down the action. So for this, like this I have done for the entire lower limb. So in this entire page, the entire page has muscles, nerve supply and actions of lower limb. Like this, you can make one page for lower limb, one page for upper limb, and that is all you need to revise whenever you are doing revision for this particular topic. It includes all the other nerves, femoral nerve. So femoral nerve I have written at the top, muscles supplied and their actions. Then other nerves, their muscles and the action. At the side over here and over here also written down all the actions. This is what you need to revise. That is it. Only this much is important. You don't need to go through all the pages given in the textbook, but only this will work if you have made proper notes. If you have just copied down everything that is given in the textbook, then it's not going to help.